Our next speaker, Len Duhl, makes a perfect complement, I think, to the speech by Russ Akoff and his dour view of the situation, particularly in the United States. It doesn't apply only to the United States, but I'm afraid, as in so many other respects, Americans are a hyperbole, an exaggeration of phenomena that occur in many other countries. But one of many things that have been done to try to wrestle with these problems and to find new and better ways of dealing with the problems of health and welfare in human societies is a program that really is the brainchild of our next speaker, Len Duhl. He not only originated but still plays a key role in the Healthy Cities program, which is worldwide. Now, if I recall the number correctly, it's about 1,700 cities.
7,500.
7,500. Yeah, I got it wrong. A lot more even than that. 7,500 cities worldwide that are using the Healthy Cities program. And he will be talking about that today. He's a professor of public health and urban planning at the University of California at Berkeley in the School of Public Health. He's also a professor of psychiatry at the University of California in San Francisco and executive director of the International Healthy Cities Foundation. He also has had many years of government service. He was chief of planning at the National Institute of Mental Health in Washington, and also an assistant secretary in the Department of Housing and Urban Development in the Model Cities program. And before that was worked with the Peace Corps, so he's had extensive experience in government services as well. I understand he's also a consultant to the World Health Organization and the Pan American Health Organization. He, among many other writings, has published Social Entrepreneurship of Change, a book that's just recently been reprinted. I should also mention that his speech this morning will be an introduction, in a sense, for a panel that will be held downstairs in room A60 this evening on the Healthy Cities experience in the city of Toronto, with a number of public officials and people who have been involved in the Healthy Cities program here in the city of Toronto. So I urge you to attend that. Without further ado, Len Duhl.
I was going to talk about unintended consequences, and the best way to start is to say I have to sit down because I was skipping with my granddaughter, who was about 4 years old, and I almost broke an ankle, and now first the ankle went, now the knee went. So the unintended consequences of being nice to a grandchild is you got a hurt leg. I wanted to talk about the health system, and Russ Akoff really gave a magnificent introduction to the problem. I'm not so sure he came up with the right conclusion, however, but I'll get to that. I also want to, before I start, acknowledge his comment about learning from students, because your next president, Harold Nelson, is one of our students in Berkeley and one of Churchman's students. And I think as a group, we really learned a lot together. So thank you, Harold. I was asked to talk about Healthy Cities, but I've really got to go back in time to my days at the Mental Health Institute, where, and I keep repeating this, the injunction of Congress was that we be concerned with the care, treatment, and rehabilitation of the mentally ill, and the mental health of the population of the United States. Now take out the mental side and we'll talk about health. So health has really two sides, and one side obviously is medical care and treatment. But sadly, in almost every study that has been done epidemiologically, it is crystal clear that our health is not due to medical care. In fact, most of our health seems to, or 90% of it, has to do with other factors than medical care systems. Now, what are they? They're the way we live, our jobs, as Russ talked about. It's our education. It's the housing we live in. Interesting enough, the transportation that we've got available to us. And I'll get back to that later when I talk a little bit about Silicon Valley. And a whole host of other things. One of the most important studies we found when I was at NIMH was that the most important thing there is in our health is our ability to command events that affect our lives. This again ties back to Russ saying that the best way for students to learn is to teach themselves, and so the best way to be healthy is to assume responsibility, not just for the medical side of health, but for the quality of life that we have. Well, way back in the 50s, I supported a major program at Harvard Medical School in the Department of Psychiatry on the west end of Boston. And they were tearing down what they said was a slum. And they said that the reason they were doing it, that this slum next to the Mass General Hospital had a very low tax base, and they wanted to increase, let's go back to it, the efficiency and the money, by tearing it down and putting up high-rise apartments. And those of you who know Star Drive, you go by the Charles Street apartments, and the big sign was, if you lived here, you'd already be home. It was there. But what they didn't know, and Herb Gans did the study, part of the study, was this community of the West End was not only a physical slum, but it was not a social slum. Meaning the extended families in that community had a tremendous social infrastructure that supported everybody. It was an Italian Sicilian population following an old Jewish population, and that support system inside this world was so complicated that it dealt with issues of education, health, welfare. When people were in trouble, they helped each other. They tore the buildings down. We decided to follow this because we were interested in the impact of crisis on people's lives. And what we discovered is that they ended up dispersing, and what was an extended family became nuclear families or single-parent families out here. And the social costs, measured by use of the emergency room, social services, the police, and on and on and on, were higher than the savings they got by increasing the tax base. But these were two different pockets, and these two pockets were never put together. And this is really the silo theory of government. Everything is in your private silo. It was then that I started to take on at that time it was Ed Loeb, who was the city planner in Boston, and saying you can't do just physical plans, you can't just do economic plans, but you had to really do social planning. This was an anathema. And I spent many years in government really talking about it. I even had the experience of Jim Miller coming to me and said, would I put a task force together to discuss the use of systems theories in government. This was in the late 1950s. It was universally rejected. What kind of malarkey is this that says that something in the military might affect something in the domestic, something here would affect something there, and that we had to think in a different, coherent way? But now let me tell you a little story of the health system. Mr. McNamara, as many of you know, had a bunch of whiz kids. Those whiz kids essentially developed something called program planning and development. Program budgeting. Program budgeting. And what it was a model to create efficiency within the Defense Department. However, when the war was over in Vietnam, most of these whiz kids had to go someplace else. I feel a little guilty about one little side of my life. I spent a tremendous amount of energy trying to get rid of, stop us from being in the Vietnam War. But when we started to see what we could do by the military-industrial complex, we said, well, send them into the domestic world. And that's where all these companies started to go into such businesses as private schools, private prisons, private health systems, and everything else. Unintended consequence, yes. Alan Eindhoven, one of the whiz kids, became the godfather of managed care. He was very bright. At the same time as he starting to talk about it, Mr. Nixon said, let's find a new way, as Russ said, of coherently looking at medical care. He looked at the Kaiser Permanente system in California, and he said, who's the guy that ran it? Not knowing that everybody was attacking Permanente as a communist system. The AMA had thrown out all the doctors who were in Kaiser. And somebody told Mr. Nixon that Kaiser was a registered Republican capitalist. So he said, okay, we will use Kaiser as a model for managed care systems. Paradoxical, but that's the way politics happens. And suddenly we got a managed care health system as a model, but Alan Eindhoven's economic system as the actual thing that occurred. So what has developed is a managed financial healthcare system, which is managed actually not very well because they're all having a tremendous difficulty. And those of us involved in the care system, which I happen to be very personally involved now since my wife just had a recurrence of breast cancer after 18 years, I spend most of my time fighting the system. And I spend so much time, I can win, but the only problem is that most people haven't got the energy. And when I talked to the insurance company, the lady who talked to me, I said, look, I'm in the same business, I teach this stuff. And she said, well, I'll tell you frankly what we do. We reject you. But of all the people that complain, more than 90 to 95% are reversed. But 95% don't complain. So we make money. A little lesson. Learn some competence about complaining and fighting it up the system. All it will use is time. Now, as I got more and more involved in this thing, and if I began to ask the question of disease from its onset through its early diagnosis and then its treatment and rehabilitation, I discovered that the official medical system was only a part of the treatment system. And it's as far back as the 50s we discovered there were many other parallel systems out there that rarely got into this system. Right now, in Oakland, California, and another thing I will talk about in a few moments, there are 273 language groups, and each one of them have brought their healers. So to understand the health system, one had to understand all the institutions within the health system and all the institutions in the parallel health system. But remember, I also said the mental health or the health of the population, and I discovered the doctors had nothing to do with the health of the population except that 10%. And you were looking at the life cycle, you found it was genetics, it was family, it was the immediate community, it was the larger community, it was education, housing, so forth, and I began to look at all these institutions. It became obvious, enough so that we wrote a book in 1962 called The Urban Condition. It is also being reprinted now because nothing has changed. What we were saying is you have to look at health and at communities in a systemic way, and they don't. It was this that became the basis and idea of healthy cities. Now, I struggled with this. I was high enough in government to raise this issue endlessly, politically, but I got no place. Times have really changed. The Assistant Secretary of Health, Phil Lee, who was Secretary way back then, became Assistant Secretary again, and about a year and a half ago he introduced me. He said, at the time Len was talking about this 30 to 45 years ago, I told him it was utter bullshit. And now he said it's the only way to go. Now what does that mean? It means times have really changed and we've gotten ready for it. But I had to lay low because nobody was interested in this. The best place to lay low was to go to a university, get tenure, be comfortable, know nobody would fire me, let them subsidize me and let me do something, find a few great students. And as Harold knows, there were an awful lot of students we could never touch. And there were a lot of students that couldn't find anybody to get them into this systemic way of doing things. You might want to know right now there's not one course on systems at the Berkeley campus, except mine, and it's not called a systems course. I laid low, and I spent most of my time locally looking at all these things. That meant I started to work and live in Oakland with students. And what we discovered was that Oakland is not the city of the newspapers of crime and drugs, but a set of many, many different, diverse communities who are quite different. But in their community, like in the old West End of Boston, they were amazingly healthy. But what they didn't have was the ability to communicate across the board. So I came up, actually, to Toronto in 1984 at the invitation of Trevor Hancock, who is going to run the meeting this afternoon. And he ran a meeting which really touched my heart. It was called Beyond Healthcare. It was here in Toronto. And what they did was he invited the sheriffs, the mayors, the police chief, the school people, the supermarket owners, the agricultural people, and a few medical health people. And at that meeting, I said, I was given the chance to give a paper. He had read my stuff, invited me here, and I said that all the stuff I was talking about is really healthy cities. How do you make a healthy city? And I said, well, if a healthy city, I'm just drawing that great city, is like a human being, It is extremely difficult for that human being to be, or city to be healthy if the liver is sick. So you had to concern yourself with the whole. But it was also important to look at the infrastructure in the human organism, and it was both the physical and the social infrastructure. And what we've now learned in cities and in all these social services is that the social infrastructure between the multiplicity of interests, values, and attitudes have broken down. So people cannot communicate. Years ago, and part of my education is I started a group that was in Washington, went for 10 years, called the Space Cadets. And we brought a lot of characters from many, many different areas together. And we discovered that it took us a year or two to learn each other's languages, to talk to each other. Actually, medical people can't talk to systems people because they don't know what you're talking about. And most of you don't know how to talk to them. And I think the private language is a really serious problem. How do we talk English or basic English to these people? So what did healthy cities become? I essentially said we have to get everybody around the same table. There's got to be a sense of equity. There's got to be active participation by, God help us, the patients, the consumers, and the people in the community. Just like the students in the school. They have to teach themselves. And that what is really critically important is to get up there and say, I do not know how to improve the quality of life of your city. What kind of city do you want? And now in the 7,500 cities, what we've discovered, and what we do is a little technique called visioning, in which we literally have them draw pictures of what they think the city will look like. Almost 85% of them have several things in common. No cars. Very interesting. All over the world, no cars. Almost all of them have open space. Almost all of them have small institutions in neighborhoods. Very few have any big central buildings. Almost all of them have a lot of green grass. And then you look around and you say, did you guys forget the jails? They are not in most of them around the world. Tremendous amount of education, tremendous amount of lifelong education, a tremendous amount of running an ability to make lateral shifts. If I want to be an accountant, can I later become this? Can I be this? Can I be this? Well, that's the first thing, is the vision. And then the second thing after the vision was, okay, what assets do you have in this community? Now, most planners look at the problems, and we decided, the hell with that. Let's ask, what are your assets? And what we discovered as we went around and they started listing the assets they had, not only was I shocked, but they were shocked at how many assets exist in a community. Or, again, I think of a class, when I go around the room, I discover how many assets there are among the students to teach things. The only thing is they don't know how to do is put the pieces together. And at that point, after the assets, you have to have what I call now a social entrepreneur or a facilitator, and that person's process is to help work through the game. Now we're back to basic education, because the way you learn is by picking a small problem in a community. And the problem, when you get all these people together, when it becomes solvable, they feel just as good as a kid who suddenly learns that they can walk or talk. They will go on to the next step, to the next step, to the next step. And that's what Healthy Cities is about. We are driven nuts by the people who ask us, where's your hard data? Well, this process will take a lifetime, 25 years. So you're talking about measuring process and change. You're not measuring numbers. But occasionally we have to do numbers, and last year I told a story, which I'll repeat, that in Oakland, in one area, the infant mortality rate was 40 to 50 per thousand, where the rest of the United States is 9, Canada's a little lower, per thousand. Well, they had for 25 years poured in all the silo services that are classic for infant mortality. We decided to set up a coalition of everybody concerned with infant mortality. We set up another coalition of everybody involved in transportation, another one on housing, another one on employment, and then we set up a coalition of coalitions, and we took as our first subject infant mortality. Of course, the guy from the transit company wanted to leave. We kept him. They stayed for 6 months. At the end of the 6 months, the infant mortality dropped 50%. No money, no new programs, but we had created a social infrastructure that somebody knew who to call somebody else when there was in trouble. Now, the program that we started went through WHO in Europe first. It spread to Eastern Europe. It spread to Canada, further into Canada. It's now all over the world. The United States was not there very early. They asked me why I didn't tell them about it. They had to learn about it from WHO, and I told them the story that I'd been in the organization for 25 years, and they hadn't listened then. But we gave money to the National Civic League in this country, which is a government, it's concerned with local governance, because we didn't want people to see this as a health program. And they are pushing it. The hospitals are now pushing it. Now, they're all pushing it for a reason. The hospitals are pushing it, and I say, to save their butt, in order to show that they're doing community services. And now I want to end by telling you what's happening in Silicon Valley. Silicon Valley is very successful economically. But as Peter knows, they're having a housing crisis, a transportation crisis, an environmental crisis in terms of the land, under the land being polluted. They also have a crisis in that its workers have to come from Stockton and Vallejo and have to commute 4 to 5 hours to do the janitorial services. Suddenly, something was a latent organization called Healthy Silicon Valley has gotten very active. And it's called Save Your Butt. Because if they do not solve that question of quality of life, Silicon Valley will be destroyed. And I would end by saying that it's correct when you talk about universities and everything else that unless they change, they're going to be left way behind. The University of California in Berkeley now gets 85% of its research money from the National Institute of Health. But that does not mean that the people in engineering and biochemistry talk to the people in public health. But actually the problems are all multidisciplinary. They're all systems, and they don't know how to do it. They also don't understand that the university is going to be a university in dispersion, that there's going to be different patterns of teaching, that students have to learn not research as much as activism. So I guess my message is there's a lot of hard data, a lot of information. There's a need for a tremendous amount of politics, but there's also a need for understanding a set of values that have something to do with other things than efficiency and money. Thank you very much.